A warm welcome to my YouTube channel Future Midwife. In the last video, I have explained you the physiological changes happen during pregnancy. In that video, I have explained almost all the system changes which happen during pregnancy. So these all changes is occurring due to the presence of metabolic changes, hormonal changes, accommodation changes and postural changes. So these all changes can be reflected in all the system as minor ailments. So today's video we will discuss about the minor ailments of pregnancy. Most of the pregnant women experience some sort of minor ailments throughout her pregnant life. These ailments could be treated properly, otherwise it can lead to some life-threatening situation. And also, I said you the most of the system will be affected by some kind of minor ailments. In this video, I would like to explain minor ailments according to the system wise. First, we will start with the digestive system. In the digestive system, there are few minor ailments. These are excessive salivation, heartburn, nausea and vomiting, constipation and pica. So in the digestive system, we can see the nausea and vomiting. Many women have this disorder in the first trimester of pregnancy, which often called morning sickness. It happens commonly in the morning when she gets out of her bed. So this can be managed by few methods which I explain you now. The first one is stay away from the orders that upset your stomach. Second one is instead of eating 3 large meals each day, eat 5 to 6 smaller meals throughout the day. Next one, snack on protein rich foods such as yogurt. Then the last one, can skip food that are greasy or high in fat. Next is constipation, which is very common during pregnancy. This is due to the consumption of some iron containing supplements during pregnancy and also before pregnancy. Apart from that, some hormonal changes also can lead to this constipation. Besides that, the growing fetus can apply pressure on the rectum, which also can aggravate the constipation. Constipation can be managed very easily. So if she concentrates on her diet, it can be managed very easily. So she has to include more water in her diet. Apart from that, the consumption of more fiber-rich diet such as cereals, pulse, vegetables and fruits can be helpful to prevent the constipation. So this constipation is triggers due to the intake of iron supplement means it can be avoided. Instead of that, she has to select iron-rich food. Next digestive system ailment is heartburn. It is common in pregnancy. The hormone like progesterone causes the valve to relax, which increase the frequency of heartburn, and also it is more common during the third trimester. The management include liquid antacid may be helpful. Avoid overeating and not to go to bed immediately after the meal. Hot tea and change of position are helpful. Excessive secretion of saliva is usually common during pregnancy. This is due to the consumption of more carbohydrate and starch containing diet. It should be preventable only if she reduces the intake of carbohydrate and starch containing food. Proper oral hygiene is very important. In some cases, bad taste from the mouth can lead to excessive salivation. Then chewing some ginger pieces can also helpful to relieve this excessive salivation. The last one is pica. It is an eating disorder. This term used when the mother craves certain food which are unnatural substances such as ice, charcoal, chalk, mud, etc. If the substances craved and harmful to the unborn infant, the mother must be helped to seek medical advice. The muscular system ailments include fatigue, leg cramps, and backache. Fatigue is very common throughout the pregnancy. As the pregnancy advances, the fatigue also get increased. So this can be due to some postural disturbances and the increased weight gain during pregnancy. It should be preventable if we are maintaining proper posture while sitting, standing and sleeping. The management include proper nap, intake of high protein rich diet and the maintenance of proper posture while sitting, sleeping and walking. Next is the leg cramp. The extra weight which you carry during pregnancy can cause leg to ache. Leg cramps are also common in the last months of pregnancy. The management include simple stretching and exercise may help these ache and cramps. Calcium gluconate may be helpful. Massage of the contracted muscle may also helpful to reduce the cramps and aches. Backache is due to the weight of the baby. The uterus and the amniotic fluid changes her posture and put a strain on the woman's bone and muscles. Too much standing in one place or leaning forward or hard physical work can cause back pain. The management include encourage the woman's husband, children or other family members to massage her back. A warm cloth or hot water bag can be placed to keep her back feel good. Adequate rest and support on the back when sitting in a chair with the help of pillow placed. Here I will explain about the circulatory system ailments. These include varicosities, piles and ankle edema. First we will see about varicosity. During pregnancy, the uterus puts pressure on the inferior vena cava, further contributing to varicose vein. They generally harmless, although they may become itchy and uncomfortable. The management include don't sit or stand for a long period of time. If you have to sit at a chair in a long time, should not cross your leg. Avoid heavy load lifting. So next is piles. These are dilated veins in your anus and can be very painful, itchy and uncomfortable, usually occurring from the 3rd month onwards. The management include have a diet high in fiber such as fruit, leafy vegetables and drink plenty of water which can help to prevent from constipation and also in turn can help to ease or prevent piles. Keep your stool soft and regular. Ankle edema is due to the increased body weight due to growing fetus, which is seen in the last trimester. It can be managed by taking proper rest in between. Avoid long standing for a long time. And this can be preventable. While sitting, we should not keep our leg downward for a long time. Instead of that, we can keep some pillow or we have to raise our leg little up. And while sleeping, keep one pillow under our leg. With all those things preventive measures, we can manage ankle edema. The nervous system ailment include insomnia and headache. Insomnia is common in late pregnancy owing to the discomfort caused by fetal movement and difficulty in finding a comfortable position. It may also be due to anxiety or fear. The management contain drink a glass of warm milk at bedtime. Tuck a pillow under the abdomen when lying in a lateral position. Talk about her fear and anxiety so that she can have a sense of normality and lightness. Headache is very common in pregnancy. during the third trimester tend to be related more often to poor posture and tension from carrying extra weight. The management include practice good posture, get plenty of rest and relaxation, eat well balanced diet and apply cold or heat pack to your head. Next is the genitourinary system ailment, which include excessive vaginal discharge and urinary symptoms. Vaginal discharge may be blood-stained, white, cream, yellow or greenish discharge. The excessive amount of normal discharge we called it as leukorrhea. Sometimes it has a bad odor. The color is white. The management include keep your outer genital area clean and dry. Wear cotton undergarments and change it 2 to 3 times a day. Wash your hands properly before and after touching your vagina. Urinary symptoms are very common during pregnancy because of the change in the urinary tract. The uterus sits directly on top of the bladder, so the uterus grows and increased weight can block the drainage of urine from the bladder, causing infection. The managements are develop a habit of urination as soon as the need is felt and empty your bladder completely when you urinate. Avoid wearing tight-fitting pants. The last management is don't soak in the bathtub longer than 30 minutes or more than twice a day. The main respiratory system ailment is breathlessness. It occurs as early as the 12th week of pregnancy and most women have this symptom by 30th week. Breathing may be affected by the increase in the hormone progesterone, which causes you to breathe in more deeply. The managements are keep your back and shoulders straight to give your lungs room to expand as much as possible. If breathlessness is disturbing your sleep, prop up yourself with more pillows. Breathing exercise and yoga is a gentle exercise that will also help you fit. In the integumentary system, some women they experience itching all over the body, especially in the abdomen. So this is due to the overstretching of the abdomen due to growing fetus. It can be managed by applying some oil over the abdomen before and after bathing. And she can use some kind of moisturizing cream which can be applied over the abdomen before bedtime. Avoid extra scratching with the sharp objects. It can again scratch the abdomen and later it become a scar. Instead of that, she can wipe with a soft cloth over the abdomen. I think this is enough in this video. I have explained most of the minor ailments during pregnancy. So here we can wind up our today's video. So next video we will meet with another episode of midwifery topic. Till that, take care. Bye bye.